This time on Healthy Body, Healthy Mind.
It looks much different than the discs above.
Lower back pain. It's second only to the common cold as a symptom that sends patients to their primary care physicians. It's a condition that can affect almost anyone, regardless of their background. And it may be caused by degenerative disc disease.
When I look back at treating a spectrum of patients, there isn't a particular patient that's at risk. We're all to some extent at risk.
Today, we'll meet two patients with degenerative disc disease who decided between two very different courses of treatment, both having positive results.
It's totally different. I'm able to work longer hours, spend more time with my family.
I feel like I have my life back. I did not want to retire. I didn't want to stop being a firefighter. I didn't want to stop doing things with my kids. I feel really blessed.
Major funding for Healthy Body, Healthy Mind is provided by Takeda Pharmaceuticals North America, committed to striving toward better health for individuals and progress in medicine. And by Wyeth, one of the world's largest research-driven pharmaceutical and healthcare product companies. Additional funding provided by Amylin Pharmaceuticals and by Synthes Spine and by Somaxin Pharmaceuticals.
Welcome to Healthy Body, Healthy Mind. I'm Carlos Pagan. Oh, my aching back. How many times have you heard someone say that after exercising, playing ball with the kids, or simply bending and lifting? Sometimes the source of this pain is degenerative disc disease, which is not really a disease at all, but a natural process of aging. How serious is it? Each year, over 60 million Americans suffer from lower back pain. And by the age of 50, 85% exhibit some disc deterioration.
The disc is the soft tissues that exist between each of the vertebrae in our spine. And this is a collagen type of a tissue, and it undergoes a degeneration. A disc is well hydrated when we're young, between our first decade and our second decade of life. And then sometimes the disc starts getting some tears in the outside.
As we age, blood supply to the discs is reduced. At about age 25, the blood supply stops, and the discs can no longer repair themselves. They lose their ability to act as shock absorbers, and chronic low back pain often spreads to the buttocks, backs of the thighs, and down the legs.
In fact, many people now consider it an aging or natural aging process. It can also be as a result of trauma.
Trauma, like a sudden jolt or even a minor car accident. Whatever the cause, we are all at risk, some through genetic dysfunction.
Some people's discs, I think, are genetically programmed to last 30 years, and some 60 or 70 years. And so that's probably the biggest risk factor. And then associated from that, we have secondary risk factors such as lifestyle.
And depending on the patient, tolerance for back pain may vary.
Okay, let's see how far you can bend forward.
We do have a number of patients that you see that are very stoic, and they rarely want to go to the healthcare provider until it's really severe.
But for those who suffer from chronic pain or even periodic back pain, there is relief. Some patients choose to treat the symptoms through a number of time-tested non-surgical methods, while others choose one of several surgical techniques. One of these newer surgical procedures relieves the pain without limiting mobility. Coming up, we'll see that early diagnosis is often the key that determines which course of treatment is made. 90% of Americans have back pain more than once or twice a year, but it's often temporary and it goes away in a day or two. Only 1 to 2% will ever need to have surgery. For more information about degenerative disc disease and other health and wellness issues, visit our website at hbhm.tv. Those who suffer from chronic back pain have some important decisions to make that could affect both their lifestyles and their careers. Carlos Bain is here to introduce us to two people who live with degenerative disc disease and will explain how they chose which course of action to take from a wide range of options.
The symptoms of degenerative disc disease in the lumbar or lower back area can be brought about through age, physical activity, or trauma. The extent of the pain and the ability to tolerate the pain often depends on the physical fitness of the patient. As we're about to see, some patients choose more conservative methods of treating the symptoms only, while others undergo surgery to attack the actual causes of degenerative disc disease. Linda Macias is a team leader in her office for Colorado Public Employees. She spends a lot of time sitting behind her computer, not necessarily a physically strenuous job, and not the type of job you may normally associate with lower back pain. One day during football season, Linda was seated on the edge of a bed, watching a game on television with her grandfather.
I turned around to look at the TV, and I just felt a pain that went down my leg, and I wasn't really sure what it was. So I stood up and thought maybe I just twisted something.
41-year-old John Ireland has been a firefighter in Pueblo, Colorado for 11 years.
When the pain started, I realized pretty quickly that there was something wrong in my back, because I started to stiffen up pretty quickly and it started hurting. It just continued to get worse.
Linda and John lead two completely different lifestyles, and they had different end games in mind. John needed strength and flexibility to continue as a firefighter for another 10 years, and Linda wanted relief from the pain. The spine is made up of 7 vertebrae in our neck, from our head to our first rib. We have 12 in our ribcage area, or our thoracic spine, and we have 5 vertebrae in our lower spine, below our ribs. In between each vertebra is a disc. Each one of these discs is an independent joint, just like a knee or a hip or ankle. The disc between each of our vertebrae acts like a shock absorber. With age, they dry out, even crack, and cause painful symptoms. Sometimes, the disc degeneration is called bulging discs or herniated discs. The resultant pinching puts pressure on or irritates nearby nerves or even the spinal column. The pain often radiates down to the hips and legs.
But you can see over this device, it allows
Just as there are many levels of degenerative disc disease and many levels of resultant pain, there are many choices available for how patients can address that pain. Early treatment for Linda simply wasn't working. Her pain continued, became even more severe.
It was bad. It was just like a numbness, sharp pain in my back. A really severe muscle spasm is the best way I could describe it. This electrical shock feeling that went down my leg. And I thought if I stood up and shook it out that it would go away.
After a week of pain, she could no longer stand it and went to see a doctor. The doctor prescribed an epidural cortisone shot, which relieved the pain for a few days.
By the following Sunday, the pain had exceeded even beyond a 10-point scale to the point where I couldn't even go to work.
How are you today?
I'm fine, thank you. How are you?
Anne-Marie Fox has been a physical therapist for 20 years.
See how you do walking?
She now practices in Thornton, Colorado.
I don't see it today.
It is extremely important to get early diagnosis of low back pain, and even more important to start early intervention.
Early conservative treatment of pain symptoms generally consists of education, weight reduction, light exercise and stretching, traction, and physical therapy by a therapist, or manipulation by a chiropractor. Anne-Marie uses intramuscular stimulation, a relatively new technique to relieve Linda's pain.
She inserts needles into the muscle to try to force the muscle to relax. And by doing that, it helps eliminate the muscle spasms. So it's a form of acupuncture, which is something I had never experienced before.
Intramuscular stimulation is a dry needling technique. It is an acupuncture needle that we insert into the trigger point to deactivate this point, if you will.
After several sessions combined with other conservative therapies, Linda is now back on track.
Good job.
I feel like I'm almost at least 90% back to where I was. I'm actually able to spend more time with my daughter doing things that we enjoy doing.
Let's just see where you're at today and don't force anything.
For Linda, the non-surgical course seems to be the right treatment for her symptoms. But often patients have to go beyond just treating their symptoms and address the cause of their pain, discs that have degenerated. Such was the case with firefighter John Ireland.
Before I started showing really bad symptoms, I was pretty active before I got hurt. I would go hunting. I'd play football and basketball with my boys and play softball with my daughters. And I was pretty active all the way around.
On one EMS call, John was attempting to lift a 350-pound man from the floor of a restaurant.
So I lifted the upper portion of his body. The ambulance attendant he was lifting the guy's feet. The mechanics of the lift were great. I had lifted with my legs and everything that you're supposed to. But when I leaned over and shifted to put the guy on the ambulance cot, I felt something unusual in my back. Dr. Janssen, that's not going to work for me.
When 10 days of physical therapy and even chiropractic treatments didn't relieve the pain, John knew he had to try something different.
I asked for a surgical consult, and actually at that point in time I got to go see Dr. Janssen.
Dr. Michael Janssen is an orthopedic spine surgeon at the Center for Spinal Disorders in Thornton, Colorado.
Mr. Ireland, how are you doing?
Good, how you doing, Dr.
The diagnosis on Mr. Ireland was that he had degeneration of the disc and complete loss of the integrity of the disc. We call that vertical instability, or severe degenerative disc disease, at two discs, the L4-5 and L5-S1. Those are the two lowest discs in your body that are supporting half of your body weight. And when they completely deteriorated, he was really very symptomatic that was altering his life. We want to look at how they're both moving and balanced.
He looked at my MRI and said, "This is a no-brainer." He said, "You've got degenerative disc disease." He told me it's just going to get worse. It's not going to get better. At that point in time, I was injured bad enough and was hurting bad enough that I couldn't actually do my duties as a firefighter.
He came to me and said, "Mike, I need another decade in my career to be able to function."
Ruth Beckham is a nurse practitioner at the Center for Spinal Disorders. She remembers the amount of discomfort John Ireland had when he first came to them.
How's everything going? When he came into our office back in 2004, he was having severe back pain, terrible back pain. He had seen chiropractors, physical therapists, had injection therapy, and nothing was helping. If it did help, like say for example the injections that he had, if they did help him, it would only help temporarily. He was miserable.
Dr. Janssen found that the discs were actually compressed and degenerated worse than he thought. One of them was, he said, paper thin.